All right, we're going to be demonstrating the pivot shift test, and this is to test for an ACL tear. And I'm Nicole, and then this is Beth, and we reviewed all of our MSA videos, and we went through them and quizzed each other on them. So for this pivot shift test, like I said, it's for the ACL. It's most effective to assess a grade 3 tear of the ACL. It's less effective with a grade 1 or a grade 2. So my patient is going to be supine. The leg that I'm testing is going to be extended. I'm going to bring her in about 20 to 30 degrees of hip flexion, and then I'm going to internally rotate her tibia. And then with this top hand, I can be providing valgus stress at that knee as well as an anterior stress at the fibular head. So then what I'm going to do is bring her into about 10 to 20 degrees of knee flexion. And what I'm looking for is for her lower leg to sublux posteriorly when I bring her into that first 10 to 20 degrees of flexion. So I should kind of see like a drop off, and that would be a positive test for an ACL tear. So now I'll have Beth show it on me, and we'll switch.
So again, like she said, we're going to do 20 to 30 degrees of hip flexion, and then I'm going to provide a valgus force or an anterior force on the fibular head, and then bring that knee into 10 to 20 degrees of flexion. Again, looking for that posterior translation. Right? Okay.
Awesome. And the patient should describe, like, if they feel that posterior sublux, they'll describe like what they feel when they're doing like a pivot or shifting, and that knee is just kind of like collapsing on them.